coronary perforation, the classical one which we use is the Ellis classification. So Ellis classifies the coronary perforation into five types: type 1, type 2, type 3, type 3C or type 4 now, and type 5. So you can see here, supposing this is a coronary artery lumen. So we take this as, so this is the coronary artery lumen. So suppose there is perforation at the lumen and there is some leakage from the lumen into the wall of the vessel. So into the wall of the artery, if there's leak occurring only limited to the wall of the artery, then it is type 1. So there is no contrast extravasation. So now if you give injection also, the contrast will not leak outside of the coronaries. So that is what is called as type 1. It has a very good prognosis, minimal risk, usually does not require any intervention. Type 2 is one when there is a perforation which is occurring, process has crossed the wall and it is occurring in the surrounding tissue. But still it is not significant enough to cause an active leakage. So there will be some staining you can see at the vessel wall, you can see some staining which is occurring, but active oozing of the blood out into the vessel, like into the pericardium, is not occurring. So that is called as type 2. Type 3 is that when there is large perforation of more than 1 millimeter with frank contrast streaming. That means that you give a dye here, that is contrast when you inject in the coronary arteries, you can see actually the blood is leaking out into the pericardium. So that is what is called as type 3. So normally this is the myocardium. You can see here, suppose this is a myocardium. So vessels are usually present on the myocardium. So over the that is the epicardium. So above that we have is what is called as pericardium is there. So between the epicardium and the pericardium normally lies the coronary arteries, so which is supplying the vessels. So usually the perforation, whenever it occurs outside. So that means that it leaks into the pericardial space. So suppose there is a very active leakage or the perforation is more than 1 mm, or that is the type C of Ellis classification. So lot of perforation will, what will happen is that in the pericardium, the blood will accumulate. Blood will start getting accumulated, and this accumulated blood will compress the myocardium, and that's what leads to what is called as the, can lead to cardiac tamponade. So this is called as type C. Supposing the blood is leaking inside, that means from the lumen, if it is leaking and it is going inside of the cavity, that means right atrium or right ventricle, left atrium or left ventricle, inside the cavity if the blood is leaking, then it is called as type 4 or type 3C. So 3C is nothing but 3 cavity. And this all type 1 to type 4 is basically we're talking about the main or mid branch of mid coronary arteries. And type 5 is nothing but a distal coronary perforation when there is perforation in the distal coronary arteries. So you can see here, class 1, there is slight crater you can see here. Type 2, you can see here there is some leak is there, but less than 1 mm of exit hole. And class 3 is more than 1 mm exit hole. You can see whenever you give a dye, there is active gush of the contrast which is leaking into the pericardium. So you can see here, this is a left coronary artery, left main coronary artery, and this is the left anterior descending artery. You can see the blood is leaking here. So this part, all this part you can see here is the perforation. So wires has been passed, but now since all the leakage is there, the distal part of the LAD is not getting stained. So there is no injection going here. All the injection is going into the pericardium, leading to a large perforation.